Welcome to my channel Health for You. Iron deficiency anemia in women. Pregnancy, significant menstrual bleeding, and uterine fibroids are all reasons why women are more likely to experience iron deficiency anemia. Heavy menstrual bleeding occurs when a woman bleeds more or longer than women typically bleed during menstruation. According to the Centers for Disease Control and Prevention, typical menstrual bleeding lasts for 4 to 5 days and the amount of blood lost ranges from 2 to 3 tablespoons. Women with excess menstrual bleeding typically bleed for more than 7 days and lose twice as much blood as normal. According to the National Heart, Lung and Blood Institute, an estimated 20% of women of childbearing age have iron deficiency anemia. Pregnant women are even more likely to have iron deficiency anemia because they require greater amounts of blood to support their growing babies. A pelvic ultrasound can help a doctor look for the source of excessive bleeding during a woman's period, such as fibroids. Like iron deficiency anemia, uterine fibroids often don't cause symptoms. They occur when muscular tumors grow in the uterus. While they are not usually cancerous, they can cause heavy menstrual bleeding that can lead to iron deficiency anemia. Iron deficiency is one of the most common nutritional problems in the world, and disproportionality affects women and children. Stages of iron deficiency can be characterized as mild deficiency, where iron stores become depleted; marginal deficiency, where the production of many iron-dependent proteins is compromised but hemoglobin levels are normal; and iron deficiency anemia, where synthesis of hemoglobin is decreased and oxygen transport to the tissues is reduced. Iron deficiency anemia is usually assessed by measuring hemoglobin levels, but this approach lacks both specificity and sensitivity. Failure to identify and treat earlier stages of iron deficiency is concerning given the neurocognitive implications of iron deficiency without anemia. Most of the daily iron requirements is derived from recycling of senescent erythrocytes by macrophages. Only 5 to 10% comes from the diet. Iron absorption is affected by inhibitors and enhancers of iron absorption and by the physiological state. Inflammatory conditions, including obesity, can result in iron being retained in the enterocytes and macrophages, causing hyperemia as a strategic defense and mechanism to restrict iron availability to pathogens. Premenopausal women usually have low iron status because of iron loss in menstrual blood. Conditions with further increased iron loss, compromise absorption, or increased demand, such as frequent blood donation, gastrointestinal lesions, athletics activity, and pregnancy, can exceed the capacity of the gastrointestinal tract to upregulate iron absorption. Women of reproductive age are at particularly higher risk of iron deficiency, and its consequence. However, there is a controversial argument that evolutionary pressures have resulted in an iron deficient phenotype which protects against infection.